name's Ann Mattingly. I am a breast surgical oncologist, and we are at the breast center at Hendricks Regional Health. We see patients with breast problems, everything from benign breast disease like infections and breast lumps all the way up to breast cancer. I would never wish breast cancer on anyone, but I think now we're much better equipped to deal with it. And I think we're also much better at diagnosing it and finding it early at a more treatable stage. We have algorithms that we use, and we use individual risk factors in these kind of population study algorithms. And we can use a person's individual risk factors and put them into the algorithm and understand based on their personal risk where they fit on the risk of breast cancer. We have upgraded all the machines here for 3D mammography, which is more accurate at diagnosing cancer. You have a decrease in the false positives, people coming in for what ultimately turns out not to be cancer. And we also have started a same-day high-risk program, meaning those algorithms that I talked about where we look at a patient's personal history, we do that at the time of their mammogram. So the Women's Center, the Center for Breast and Bone Health, they will put the person's history into the computer system, and the software will give us a risk score. And then if they're classified as high risk, they're offered a same-day appointment with our high-risk nurse practitioner. And she goes through their history and talks about what their options are because of their increased risk or family history. Anybody that's been diagnosed with breast cancer, we try to have them see a breast surgeon or breast surgical oncologist within 24 hours of diagnosis. I have treated male breast cancer patients, so men can get breast cancer, and if they find something, now they don't need to get annual mammograms the same way that a woman does, but if they find something, they shouldn't ignore it. I mean, it's a journey, and that first visit is a big eye-opener for most people. I always recommend that they bring a trusted family member or friend, because a lot of what we talk about is kind of gonna go in one ear and out the other because it's so overwhelming. It's the first of many visits, and I tell people that it's a journey because they are gonna see me at least every 3 to 6 months for 5 years. And so they are going to be followed closely by their doctors as they go through treatment, and they're going to have lots of opportunities to ask questions along the way. I think it is a very empowering moment for breast cancer patients and their families. A lot of breast cancer is things happening to the person or the patient, a lot of treatment that they don't really have much control over, but this is something that they have control over, that they can do for themselves or their family member to help raise awareness for breast cancer and support them.